Thanks for changing the oil in my car.
It's the least I could do for all the times you've helped when I couldn't afford to pay. When the governor said we'd have universal coverage, I thought my worries were over about medical bills. Now I've got an insurance card in my wallet, but you still need the old do-re-mi to get health care.
You're not alone. In addition to the 45 million Americans who are uninsured, another 25 million are underinsured. Here in Massachusetts, over 1/3 of those with insurance skip medical tests and treatments because they can't afford them.
You know, I just don't understand how this can happen in one of the richest countries in the world.
We're the only developed country that doesn't have universal health care. The sad thing is that we spend twice as much per person as the other countries, but get so much less in return.
Where on earth is all that money going?
All that dough, where does it go? 30% for bureaucracy, 20% for private profit, 30% for hospitals and MDs, 10% goes for prescription drugs, 5% for medical research, 1%, just 1% for public health. Does this make sense? Oh no, 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 for all that dough. What do you know? We're 46th in life expectancy, 37th in health system performance, 34th in infant mortality. Of all industrialized countries, most deaths from preventable disease. World Health Organization ranks us between Costa Rica and Slovenia.
So, you're saying we throw half of every health dollar away on non-medical stuff?
Yup.
And our health system, which is supposed to be the best in the world, ranks with Eastern Europe and Central America?
That's right.
We need to learn from the countries who are doing better than we are. What are they doing right that we're doing wrong?
Well,
let's see. How much dough do other countries blow on insurance administration? 4% in Canada, 2% in France. The rest they use for taking care of patients. We don't need to spend more dough just to change the place it goes. Private insurance doesn't pay unless you happen to be their CEO. Ho, ho.
But if we didn't have private insurance, how would we pay for health care?
countries pay for health care in different ways, but they all have two things in common: not-for-profit and everyone included. Spain and England have national health systems where the government provides health care directly, like the VA here, except for everyone. The government owns the hospitals, and the doctors work for the government.
Germany and Japan have non-profit sickness funds which are separate from, but highly regulated by their governments to make sure they are affordable, fair, and cover what people need.
Canada and Taiwan have national health insurance. The government doesn't employ the doctors or run the hospitals, but pays people's medical bills and gives the hospitals funds to operate. With national health insurance, doctors can work wherever they want, and patients can go to whoever they want. Because the funding all comes from one place, it's also called single payer.
I don't think Americans want a government-run health system, and the insurance companies have so much clout here that they control the government instead of the other way around. That leaves national health insurance. Sounds kind of radical. Do you really think the American people would go for it?
Well, we already have a popular single-payer system for seniors called Medicare, which has been in place for over 40 years. If everyone had Medicare, which only spends 3 to 5 cents per dollar on administration, most of that $0.50 we've been throwing away could be used to pay for the uninsured. And when the payer answers to the people instead of to private stockholders, we can decide together where to put our health dollars, like spending more on prevention, which in the long run saves money too.
In Massachusetts, health reform increased spending, and over 100,000 people still don't have coverage. Even though the law requires everyone to buy insurance, they had to make exceptions for the middle class since the premiums are double what they can afford to pay. And the states spent so much subsidizing premiums for low-income families that they had to take funds away from safety net hospitals and clinics and cut public health programs like vaccinations and stopping the spread of VD.
That's because in Massachusetts, the state, employers, and individuals pay for health coverage through private insurance companies who still use up healthcare dollars on bureaucracy and profits.
These are hard times. Can our country really afford health care for all?
Well, doing nothing will cost even more. Without national health insurance, health spending will double in the next 10 years. Economic analyses comparing single payer with other proposed reforms show it is the only plan which will reduce our skyrocketing spending.
Switching to a single payer system would save $400 billion by cutting out bureaucracy and profits, enough to pay for health care for all the uninsured. And bringing those new patients on board would also create 2.6 million new jobs and $100 billion in new wages. That's an economic stimulus which helps regular people instead of corporate executives.
We can't hold it off any longer. There's too much pressure for reform. They're going to do something, and we need to make sure that something doesn't interfere with our profits. If those single-payer people get their way, we'll be out of business, and we'll never find another business this good.
And they're all up in arms about drug prices. If they come out with a plan that gives the government bargaining power, we'll lose our profits too. Countries with national health plans pay us half of what we get in the U.S. for the same medicines.
But we can't come across as being against everyone getting health care. That will be bad for our image.
No, we've got to appear like we support health reform, but do everything we can behind the scenes to make sure it doesn't really happen. Let's make a public statement that we support universal coverage. Everybody likes universal coverage, but all it really means is that we wish everyone could have insurance.
You know, you're onto something there. What if everyone really did have our insurance? If the government would pay us to insure people who can't afford it, that would be more money in our pockets, huh? And what if they made it a law, like in Massachusetts, that everyone had to buy insurance from us? Then we'd really have the bucks rolling in. We could set it up with enough deductibles and co-pays that no one could afford to use it. Then we'd collect the premiums and take them straight to the bank.
Oh, Wolfgang, I love it. You're a genius.
But we need to get that law passed quickly before the public figures it out and gets organized to stop it.
Let's have a talk with our friends in Washington.